Hey everyone, I'm Dr. Michael Hyman, and I really just wanted to talk to you about, frankly, who I am, what kind of doctor I am, and my areas of expertise, my background, and my style of practice. Honestly, some of the things I'm going to tell you I think are good things to ask any doctor that you're going to see, and try to get a sense of whether that's going to be a good match. My background is that I trained in New York City at Cornell for both medical school and residency. Let me tell you, the thing you really want to ask your practitioner, in my opinion, is where they did their training. Medical school, of course, is important. I'm certainly very proud that of my medical school education at Cornell Medical School, but my residency training, which is where you actually learn the specialty that you're going to do. So if you're going to be a urologist, you do a residency in urology. If you're going to do dermatology, you're going to do a residency in dermatology. That's really key because that's where you really gain the expertise, and that's where you're going to hopefully have the worldwide experts in the field training you your craft. And that's fortunately what I was able to have the honor, privilege to have done at Cornell all those years ago. The other thing that you want to ask doctors about, and that I can tell you about, is what has been their clinical practice. In my case, I have been performing a variety of urologic procedures for the past 20 years here in Los Angeles. I now practice in Encino. The kinds of procedures I have performed range from robotic surgeries, complicated bladder and prostate and kidney surgeries, kidney stones, bladder and prostate cancers, to mostly now office urology. I would say the majority of the patients I now see are folks who have benign prostate conditions, folks that need vasectomies, things like difficulty urinating. I see a fair number of folks with kidney stones and recurrent bladder infections. And then, of course, all the men's sexual health issues like difficulty with erections, difficulty with sex drive, penile curvature, etc. I pride myself on my ability to explain things in very clear and concise and sort of easy to understand ways. I think that if you look at some of my other videos, you'll see that this is something that most of my patients who give me feedback say that, hey, you really took the time not only to listen to what I have and what my issues are, but to explain to me what might be going on, and then what we need to do as far as diagnostics, and then in terms of procedures, explaining what those procedures are. So these are the kinds of things that I take pride in as far as being a urologist, and the kinds of things that you really want to hear about from other doctors that you're going to see. It's been a pleasure being able to have this opportunity to speak with you. I hope you've enjoyed this video, and we'll have some other ones posted for you to listen to other conditions more specifically, and even other types of tests that you might want to hear about.